Everyone, this is Sharon. Oh, excuse me. I just closed you all out. I'm sorry. I didn't mean to do that. Did I just close everybody out? Will it come back up? Yeah.
You're fine.
Oh, okay. There we go. All right. I had moved my computer, so I'm going to do that. Good afternoon, everyone. First of all, this is Sharon McKinley. I am the Senior Consultant with the NRC for In-Home Services, which is funded by the Department of Health and Human Services through the Children's Bureau. And on behalf of the NRC for In-Home Services, we would like to welcome you to the Promoting Safe and Stable Families webinar which is on PSSF. We are calling this PSSF 101, if you will. And the purpose of the the purpose of today's webinar is to ensure that all participants at the 2012 PSS Annual Meeting are familiar with the requirements and the purpose of the PSS program. And so this will be an opportunity for you to hopefully get your questions answered after the presentation. Before we get started, we would like to know who is on the phone this afternoon. So if you can, if you could please state your name and what state you're calling from. That would be very helpful.
Start east to west.
Starting from east to west. How about that? Coast to west coast.
Johanna Hatcher from Florida.
Sandy Gallagher from Pennsylvania.
Curtis Smith, Virginia.
We missed that one.
Curtis Smith from Virginia.
Okay.
Kristen O'Connor, North Carolina.
Bobby Dick, New York.
Michelin Deeds, Alabama.
Jennifer Meyer and Donna Bounds, Alaska.
Dickie Artist, Delaware.
Guy.
Could you repeat that again? Somebody was beeping in over here.
Guy Thompson from Michigan.
Hey, guys.
Tara Harvey from Iowa.
Lindell Lewis, Virginia.
Diana Weber, North Dakota.
Janet Bear Carpenter, Kansas.
Hello.
Yvette Sandoval, New Mexico.
Kevin Higgins, Montana.
Cosette Mills, Utah.
Cosette Mills.
Cindy Ruth, Nevada.
Ron Hager, Oregon.
Kathy Morris, Idaho. New Mexico. Yvette Sandoval, New Mexico.
Could you repeat that, please?
Yvette Sandoval, New Mexico.
Nadja Jones, Nicola, Oregon.
Okay.
Laura Martin, California.
Anthony Ellis, Louisiana.
Anyone else on the phone who didn't introduce themselves?
Kenya Johnson, Mississippi.
I'm Shauna Folsom with the Choctaw Nation of Oklahoma.
Daphne Billingsley, Tennessee.
Anyone else? Anyone else? Okay. All right, so let's do this before we get started. Could you all please mute your phone with star so that we cannot hear all the little rustling sounds in the background? That would be very helpful. Thank you. That is so helpful. Thank you so much. Okay. Someone just came on. You want to introduce yourself? Whoever came on, you want to introduce yourself? Okay. All right. Okay. All right, so we're going to go ahead and get started. And before I just basically want to make sure everybody has muted their phone. Our facilitators today are three wonderful ladies from the Children's Bureau. Gail Collins, she is the Director of Children's Bureau Division of Program Implementation. That division oversees the major federal child welfare programs for the state and tribes, including Title 4B, the Stephanie Tubbs Jones Child Welfare Services, and Promoting Safe and Stable Families Program, Title 4E Foster Care, Adoption Assistance and Guardianship Assistance Program, and the Kathy Foster Care Independent Program. Previously, Ms. Collins served as an acting Deputy Commissioner of the Administration on Children, Youth, and Families, and held positions in the ACF Office of Legislative Affairs and Budget, as well as the formal National Center on Child Abuse and Neglect. Ms. Collins also received her Master of Public Administration degree from the George Washington University and her bachelor's degree in history from Georgetown University. Catherine Heath is a child and family program specialist at the Children's Bureau. She is the youth specialist at the Children's Bureau and is responsible for the Chaffee Foster Care Independence Program and is the lead for the state program Promoting Safe and Stable Families Program. Ms. Heath has been at the Bureau for 3 years and was the statewide independent living coordinator for the state of Florida before joining the federal government. And then we have Eileen West, who is the program specialist also for the Children's Bureau. Her program areas include tribal Title 4B child welfare programs, Title 4E plans, and the Adoption Assistance Program. In addition, she is the federal project officer for the tribal Title 4E plan development grants. Eileen started her child welfare career investigating allegations of abuse, neglect, and moved to the state level to child welfare policy program development and developing a quality assurance policy, similar to the current Child and Family Services Review. Ladies, give me just 1 second. I'm going to just move to your screen in a minute. I just want to make sure that everybody is aware that if you have not already registered for the Promoting Safe and Stable Families Grantee Meeting, you can still do so, and you can do so by going to the website here to do that, and then also contacting Diana Pera, who is here in the room. And if you haven't done so and you need to, you can also please get in contact with her as soon as possible because the time is running out. And then, of course, you know about that, about the next conference, right? So, having said that, I'm going to turn this over to my ladies over at the Children's Bureau, and I don't know who's going to take the lead, starting us off with the history and purpose of promoting safe and stable families.
Hi, Sharon. This is Gail Collins.
Okay.
I'm going to get us started here. We thought that as a backdrop for all of you to attend the meeting, that especially for those of you who may be newer to your positions and to working on this program, it would help to have just sort of the background of the legislative history and also try to sort out when we're talking about the Promoting Safe and Stable Families program, there's the sort of formula grant program per se that's for family preservation services, et cetera. But there are also other grant programs and things that are authorized under that section of the law, so sometimes it gets a little bit confusing. So to either clarify or leave you totally confused, I will attempt to do the quick legislative history for the program. So we begin back in 1993 when a law was passed as part of a big Omnibus Budget Reconciliation Act that created what was then called the Family Preservation and Support Services Program. And this was a pretty exciting thing at the time, especially because then as now, there was a lot of concern that a lot of federal dollars were going into out-of-home placement, and this was a funding stream that was specifically designed to focus on prevention and family preservation, so to prevent kids from going into foster care. It was established as what's in budgetary terms called a capped entitlement or mandatory program, and in budgetary terms, that means that the amount of funding is basically specified and automatically kind of appropriated in law. Some other programs that we operate have what are called authorizations, and in those cases, Congress may, for instance, authorize up to $100 million, but when the appropriators appropriate, you only get $40 million, things like that. So with mandatory money, it was a given that the money would actually come at the level that was specified in the statute. So that was also an exciting thing. The law also from the beginning had certain set-asides, specifically for evaluation and technical assistance. So from the beginning, there was a desire to both support states and tribes in their implementation of the program, and also to try to evaluate some of the types of services that were being offered. In the same law, there also was created the State Court Improvement Program that focuses on giving grants to the highest court in each state to improve the handling of child welfare cases. And again, that money was sort of carved out of the total amount of money authorized under that section of the law. So again, that we started in 1993. Can we move on to the next slide? Yes. So then, looking at 1997, the Adoption and Safe Families Act came along. As I'm sure you all know, that had a lot of major reforms for the child welfare system and the foster care system. But included in that law was also a reauthorization and expansion of the program. So where it had originally been the Family Preservation and Support Services Program, it was given its new name, the Promoting Safe and Stable Families Program. And in giving it that name,
Yeah.
Welcome to ICF's Ready Conference. Please hold while I confirm your passcode. Thank you. Your passcode is confirmed. When you hear the tone, you will be the 35th person to join the meeting.
And every year since then, states have been submitting their annual updates. Those are always due June 30th each year. The regions are primarily responsible for reviewing and approving those CFFPs and the APSRs, but we also have a hand in drafting the program instructions and then also working with the regions around specific requirements and then coordinating the approval of that information to our grants management office and to others. We post information on our website, the states and tribes, the APSRs and the CFFPs, and we also encourage states, we require states to post that on their websites and make that information accessible to the public so that they know how the program funds are being spent at their state and community levels. Eileen?
Thank you, Catherine. And at the same time that information is shared, states and tribes are to be sharing their plans with each other and to be cooperating, coordinating with each other. There are some places and situations where they're actually working with the same families, or sometimes the families are back and forth between the systems. So what I would like to do now is move on into two parts here in terms of PSSF. First of all, to talk about what the purpose of the program is, and then to go into the definitions under PSSF. So starting first with the purpose, there's four key purposes here, and that is to enable states and tribes to operate a coordinated program. First objective is community-based family support services. These are services aimed at preventing child maltreatment among families at risk through the provision of supportive family services. Another one is the family preservation services, which are services to assure children's safety within their own home, to preserve intact families in which the children have been maltreated, and that's when the family's problems can be addressed effectively. Another one is time-limited family reunification services. Here, it is to address the problems of families whose children have been placed in foster care so that they can be reunified in a safe and stable manner in accordance with the Adoption and Safe Families Act. And the fourth one is the adoption, promotion, and support services to provide supportive to adoptive families, but providing support services is necessary so they can continue to make that lifetime commitment to the children. So now what I want to do next then is move on to what each of these different kinds of services are, starting with the family preservation services. And that means services for children and families designed to help them, including the adoptive and extended families at risk or in crisis. Now, these services are programs designed to help children where it's safe and appropriate to return to families from which they have been removed, or to be placed for adoption with a legal guardian, or if adoption or legal guardianship is determined not to be safe and appropriate for a child, then in some other planned permanent living arrangement. Pre-place and preventive service programs include such programs as intensive family preservation programs. They are designed to help children at risk of foster care placement remain safely with their own families. Service programs can be designed to provide follow-up care to families for whom a child has been returned after the child has been in foster care. Also provides respite care for children to temporary relief for parents or other caregivers. That includes the foster parents. Services designed to improve parenting skills by reinforcing parents' confidence in their strengths and helping them to identify where improvement is needed and to obtain assistance in improving those skills. Now, that's with respect to matters such as child development, family budgeting, coping with stress, health, nutrition. And then the last one is the infant safe haven programs, which is a mechanism to allow parents to safely relinquish their newborn at a safe haven that's been designated pursuant to the state law. Okay, on this slide you'll see down at the bottom there's part of it's been underlined, and you may see it on a couple other slides too. Underline means that that is new language from the legislation that Gail had been talking about earlier. So continuing now with family support services, these are community-based services. Their intent is to promote the safety and well-being of children and families, to increase the strength and stability of families, to increase parents' confidence and competence in their parenting abilities, to afford children a safe, stable, and supportive family environment, to strengthen parental relationships, promote healthy marriages, to enhance child development, including through mentoring. And then you'll see the section in the Social Security Act where mentoring has been added. Okay, thank you. Okay, moving on to time-limited family reunification services. These services and activities, again, to provide for child safety and keep the child at home as long as it's possible to do that. Now, these kinds of services would include like individual, group, and family counseling, inpatient, residential, or outpatient substance abuse treatment services, mental health services, assistance to address domestic violence, services designed to provide temporary child care and therapeutic services for families, including crisis nurseries. Here's a new one, peer-to-peer mentoring and support groups for parents and primary caregivers, services and activities designed to facilitate access to and visitation of children by parents and siblings, and then transportation to and from the services and activities that we just went through. You can see there's a very broad list here of services that 4B will fund. Okay, moving on. And then the fourth one, the adoption, promotion, and support services. Now, that term has been defined to mean services and activities designed to encourage more adoptions out of the foster care system when adoption promotes the best interest of the child. And that would include activities such as pre- and post-adoption services and activities designed to expedite the adoption process and support those adoptive families. So, Catherine,
Great.
Back to you.
Thank you. And I think many of the folks on the phone who are familiar with the community-based child abuse prevention program will notice that there's many similarities between the Promoting Safe and Stable Families program and the goals of the community-based child abuse prevention program, or CDCAP. We do know a lot of you guys wear both hats or work in both those programs and work really hard to coordinate those efforts. We do believe that coordinating the efforts between the Promoting Safe and Stable Families program and the CDCAP program are really critical in preparing a service array in your communities and at the state level that really meets the needs of families in the way that in the way that those programs are designed. So let's talk a little bit more about the money. So for states, they're required to spend what is called significant portions of the grant on each of the different service areas. So originally this was about 25% each towards the family preservation and family support. But now, with the 4 program purposes, we ask states to approximate 20% on each of the different 4 service areas, which Eileen has just described: the family preservation services, the community-based family support services, the time-limited reunification services, and the adoption, promotion, and support services. In addition, we require that no more than 10% is spent on administrative costs. Now, states can apply to us and ask for an exception to that if they already have a significant amount of funds that's already going towards one of the program areas. For example, many states already have robust programs around adoption, promotion, and support services, so it may not make sense for them to be spending the full 20% on that service area. Instead, it may make more sense for them to be spending on family support services. Next slide, please. So each year, as part of your submission of your your APSR, states submit to us their planned expenditures for the Promoting Safe and Stable program. And so for 2012, you can see where states have provided information to us on the categories where they'll be spending their money. So you can see about that the greatest percentage is being spent, about 26% on crisis intervention or that family preservation group. That then we closely followed behind that is 25% on the prevention and support services, and then about 22% on the time-limited family reunification services, and then about 20% on the adoption, promotion, and support services. I think what's interesting to note is that states have the limit of spending up to 10% on administrative costs, and really about 4% of that is being spent on administrative costs. And that's for 2012, what states are planning to expend in terms of their Promoting Safe and Stable Families program. So, next slide, please. So also as part of the submission each year to us, states need to report to us what they actually spent. So the last year that we have the information on how states actually spent their Promoting Safe and Stable Families money is 2009. As you can see, the greatest category is once again promoting. It has shifted slightly from the crisis intervention to the prevention and support services, with about 26% of the money is being spent there. 24% of the money is being spent on family preservation. 23% is being spent on time-limited reunification services, which is a slight tick up. And that 20% is still being spent on that adoption, promotion, and support services. And once again, about 4% is being spent on administrative costs. Next slide, please. So we pulled some numbers just to show you across a couple of the years what the planned expenditures are for the Promoting Safe and Stable Families program. So this is basically the information that we provided earlier in a table format. And you can see that, you know, while there is a little bit of decrease from 2010 from the family support services to other categories, that basically there's only a little bit of variation between years in terms of what states are planning on spending. Next slide, please. So that was kind of the national picture. I know this graph is very busy, so we're going to spend a little bit of time on it. This is information of how states are reporting the percentage of the funds that are being spent on each of the different categories, and like I said, it's at the state level. So you can see that there is, while there is a pretty, nationally there's a pretty even picture of how the money is being spent, that at the state level there's a lot of variation. And like I said before, states can apply to the regional offices to be able to request an exception from the 20% rule if they already have either a significant amount of federal or state funds going towards that purpose in order to fund that program purpose. Great, so we're going to move on to our last slide, which is questions.
Okay. At this time, you all can unmute your phone with *6. And then if you have any questions, you could, at this time, ask the ladies at this time. And hopefully you can go one at a time, starting from east to west again at this time, okay? Question? Now's the time.
This is Cosette Mills from Utah. I've got a few questions that might not be the questions you want based on the presentation, because we focused just on the 4 priority areas of PSSF. But I wondered if, as part of our meeting, if the authority for the caseworker visitation funds is something that will be addressed. I don't know what any other venues where that's talked about, but I would be interested in really learning how other states are using those funds to strengthen caseworker visitation, and especially considering the new restrictions in the law, where they eliminated technology as one of the primary uses for the funds. So I was just wondering if either you could address that now, or if we will be addressing it in the meeting. I guess one other question that's related to this also is,
when the law changes, as this one did last fall, if the award was received prior to the change in the law, can we continue to use the funds for that award using the prior purposes, and then the new funds have to use the new purposes? So that's a whole bunch of questions, but they're all related to the caseworker visitation piece.
Sure. This is Gail Collins. My understanding is I don't believe there's a focus particularly on the use of the caseworker visit grants as part of the upcoming meeting. You know, that the kind of context for this meeting originally was, and tying it in with the in-home resource center, was really to focus on the types of community-based services. We did want to give the legislative context because it does get confusing when we talk about promoting safe and stable families, because it's like a section of law as well as the name of a program. So I understand that it's interconnected, and I'm not sure to what degree the same people in each state are responsible for determining how the caseworker visit grant is used versus how the safe and stable families grant. There may be a good deal of overlap, or in some states it may be sort of in different places. I can answer the basic question in terms of the law did make some changes in the purpose for the monthly caseworker visit grant. The change in definition is applicable starting with the fiscal 2012 grant. So the old definition applies for fiscal 2011 and earlier years. Starting with 2012, the new definition applies. You basically need to make a justification for why what you're doing supports the current purpose. The fact that they took technology out of the definition doesn't necessarily mean that you can't do anything around technology, but you have to, you know, make a case for how what you're doing is supportive of the new purpose. If you're doing something that truly is not in line with the new purpose, then you would no longer be able to use that grant funding for that particular purpose. I think if there, you know, if we're hearing there is a desire to have some more conversation among states, I'm sure we could figure out another forum for doing that.
Okay, great, thank you.
Sure.
And just another quick question, I wondered if you could just send out to the participants the bios on the people that are the panel members. You went so fast on them. Sometimes it's helpful to remember whose expertise is what.
Sure. I'll do that.
I'm sure we can do that, but probably more useful than the biographical material. Again, I'm Gail Collins. I'm the director of the Division of Program Implementation in our D.C. central office. Catherine Heath is on, and Eileen West are both on my staff, so we're all in the Division of Program Implementation. Catherine Heath, again, is the contact for the state Safe and Stable Families program. She's also our youth specialist. Eileen West is our contact for the Tribal Safe and Stable Families program, and Eileen is spending bulk of her time working on tribal issues now, both 4B and working with tribes that are moving towards 4E.
Okay, thank you. That's helpful.
And then I think most of the contact that you guys have is with the regional offices. We're organized into 10 regional offices with the regional program manager. Generally, each region has a person who's assigned to your state, although depending on if there's a specialty issue like CVCAP or older youth in foster care or some sort of other special project, there might be someone who's more coordinating that and working with the other people on the team around the work that the specialist is doing in the state.
Thank you. And can you give us an estimate? What's the approximate reduction that the $20 million that went to CIP resulted in? We haven't seen our awards yet to know how much ours was reduced.
Bear with me. See if I have here. At the national level, it looks like at the national level for states only, and here I'm for the moment leaving out Puerto Rico and the territories, the amount from states went from about $329.3 million in 2011 down to $310 million and change in 2012.
Okay.
Thank you. Sure. I believe awards actually have been made, so somebody in your state should have yours, or, you know, offline if you have a particular question about your state's allocation, you can be in touch
with your regional office or with us, and we can get you the information.
Thank you.
This is Lindell Lewis from Virginia.
Hi, Lindell.
Hi. I have a question also that may not be appropriate for this session, but on your table that shows the expenditures per state in each of the service areas, the ones that have real keen spikes in time-limited family reunification services like Oregon, Kansas, and Iowa, do you have any information about the types of services? Are any special initiatives that they are doing that can be shared with other states? Because time-limited family reunification, the services are very narrowly described under PSSF.
If there are people from the states that were mentioned as using a fair amount of money on those, I mentioned Oregon. I didn't hear which other.
Kansas and Iowa.
So anybody from Oregon or Kansas or Iowa, would you want to speak to that?
The other thing is it might be also an interesting thing for the Resource Center to take a look at, maybe in one of our quarterly webinars, have those states present on time-limited reunification services and what they're actually doing.
We're writing that down right now.
And we
I want to remind everybody that we post these plans site. So if you want to be more in depth, it's on there yet or not, but we've been posting them there, so that may be helpful too.
This is Kara Harvey from Iowa. I can speak to what we have been doing in the state of Iowa. We have what we call a PSSF menu of services, and it's just a varying list of services that our service areas can utilize when they're looking at what works best for their service area to meet those needs to achieve timely or reunification. So some of the things that we have been doing has been, being able to provide the substance abuse treatment or the mental health or the transportation. The other big key that what we have been doing, and I'm glad to see that it was in the reauthorization language, was the mentoring component. Because we have what is called a parent-partner approach, and we currently have a implementation project with the Midwest Child Welfare Implementation Center to spread the parent-partner approach across the state of Iowa. And basically the parent-partner approach is partnering up a parent whose child has been removed with a parent whose child was removed and has been successfully reunified for a minimum of a year. And there's training involved for the parent partners. It's a whole kind of a system thing to really wrap around the parents who have had their children removed, parents who've been there and who know how to navigate the system and really who can give that support to those parents. So that's one of the things that we have been utilizing it for.
Thank you.
Any other questions? Or if you'd like to share what you're doing in your state?
This is Lindell from Virginia again. With all the emphasis being placed on permanency for kids and foster care numbers going down, do you ever anticipate maybe shifting the percentages or increasing in perhaps support or preservation instead of that sort of more or less even split across the service programs?
Well, again, the statute speaks to spending significant portions in each. And, if based on trends in your state and other available funding resources, you believe it would be prudent to invest things in a way that's not more or less 20-20-20, you can certainly address that in your Child and Family Services Plan or Annual Progress and Services Report and discuss it with your region and make the justification of, previously we've been spending 20%, but now we feel we really need to up that to 25%, and here's why. Again, they're not rigid. There are certain things we can't change. The 10% limit on administration is in law, and barring a change in the law, we can't do anything about that. But this is not a specific percentage written in the law. So there is some flexibility, and we always have language in our program instruction that says, if the amount you're spending in an area does not approximate 20%, make the case for why it doesn't.
Thanks.
Sure.
And this is Kara Harvey in Iowa again. So would that have to be done yearly, or would it have to be done per the new CFSP? The reason why I'm asking is that when I believe PSSF first came out, Iowa already had its own family preservation program. So we have requested and got that exception. But I'm wondering how often we actually need to be requesting that if there's like a time limit to that authorization.
Well, it's not like a formal authorization. It's basically something we do ask annually. But if you have laid it out in your Child and Family Services Plan, and you've said in your in your 5-year plan, this is the proportions we're doing, and you're basically are continuing to do that throughout the 5 years, I don't think you have to say anything more. As consistent with our plan, we are continuing to spend X, 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 and X. It doesn't need to be a big deal, and it's not a formal. It's not like you need to get a sort of special authorization. It's just one of the things that our regions that we ask them to be looking for when they're reviewing plans is that the state is either spending approximately 20% in each area or not, if not, has provided an explanation. It's worth mentioning that we have for several years now been required to submit a report to Congress. In past years, based on the way the statute was written, that really translated into we made copies of all your CFS 101 reports and sent them to Congress with a couple of paragraphs. This most recent reauthorization, they actually asked us to do some analysis. So charts very similar to what we're showing on the webinar will be included in a report to Congress. And we do sometimes get questions from members of Congress wanting to know, in fact, are states spending the 20% in each service? If not, why not? There was some discussion when the most recent reauthorization bill was pending about whether more language should be put in to either increase or decrease or make flexible or less flexible. In any case, they didn't wind up doing that. But it's to say that there is interest, and sometimes a member of Congress may want to know, well, why isn't XYZ state spending at least 20% on whatever their interest is? And so we do need to be able to go to your plan and be able to say, oh, well, we do see that Iowa isn't spending anything in this area, but here's why.
And this is Catherine, that report that Gail mentioned to Congress. It will also contain information about the Stephanie Tubbs.
The 4B1, the Child Welfare Services Program.
And, I'll make sure, and that's going to be posted on our website. We'll make sure the National Resource Center for In-Home gets a copy of it so that you guys can kind of see also how the subpart 1, which has, is more flexible funding around much broader purposes, how that plays into how states are also spending their Promoting Safe and Stable Families program. There's also a report that was done by the Congressional Research Service on both the Title 4B programs as they were previously, not with the new reauthorization, but how they were being operated before the Child and Family Services Improvement and Innovations Act of 2011. I'll make sure that the National Resource Center also has a copy of that. I think that might be of interest to folks, too. And that does also cover monthly caseworker visit information, too.
Okay. Are there any other questions, comments?
Well, I hate to monopolize the conversation here, but if no one's going to pipe up, this is Kara Harvey again from Iowa. I've had some questions brought to me in regards to the language in PSSF under the family preservation, where it states extended families, if that would also include relative placements, because there is the emphasis on placing children with relatives versus non-relative care, and oftentimes those placements need supports or helps in order to prevent the placement from disrupting. So I was wanting to know if under the family preservation and family support, if services provided to relative placements would be an applicable, or would it be applicable to that particular placement? And then also for the time-limited reunification services, if it's a non-relative placement, if services can also be provided under that. Just trying to figure out if these families are included and what the best category would be to assist them.
When you're speaking of these families, are you thinking of them as, is it relative foster care you're speaking of, so they're in the placement and care of the agency, or is it that in a more informal setting, a more diversion kind of setting?
It would be really both. There are quite a few cases, and I would say probably the majority of our cases, where the department has been giving placement and care responsibility, and the placement is actually with a relative, some of whom are licensed foster care providers, but the majority of them are not.
Okay. I think probably it would be best if you could submit the question through your regional office, and we'll get you a formal answer.
Okay.
Just sort of looking at the statute, I'm sort of thinking you probably could make a case for family preservation applying to services to keep a relative placement going. When you mentioned adoption, promotion, and support, I think that probably would have to be really in the context of a formal adoption. But to make sure I don't misspeak on a national teleconference, I think it's probably best to submit it in writing so that there aren't nuances that are missed, and I wouldn't want to do anything that would cause, problems down the line.
Sure, I can do that, and it was applicable to the time-limited reunification.
For the reunification, okay.
Yeah.
Okay.
But I certainly will submit those questions to my regional office.
Great. And remind you're with Iowa, right?
Yes.
Yes, thank you.
Mm-hmm.
Okay. Well, if there aren't any other questions, comments?
Are there any questions from, I don't know, are there folks who are new liaisons?
Yeah.
Have we totally overwhelmed you? Are there questions you might have?
We also do realize that many of you guys might be coming to the meeting, and with all the other adjunct meetings that are happening, you might be working with someone else to try and cover other meetings. So, we understand that you might be having a lot of hats on while you're in Washington.
Okay. Okay, and we also can send you links to the resources that were referenced on the call today, so that you can also download them or make sure that you have the information as well. All right. Well, if there are any other questions, no one has anything else, we will thank Catherine, Gail, and Eileen for taking time out of their schedule to explain everything to us. You do have the information, and we will be hopefully posting the information on the NRC. We thank you, and you all have a great and wonderful day.
Okay, thank you.
Thank you. Bye-bye.
Thanks.
The host left the meeting. This time, the meeting will come to an end. Thank you and goodbye.